Welcome to today's webinar, FAS Throughout the Lifespan, Providing the Best Care and Support. We're so glad you could join us. My name is Amy Gohl, and I'm the Director of Education for the Partnership for Maternal and Child Health of Northern New Jersey. The partnership is providing today's program in recognition of Fetal Alcohol Spectrum Disorders Awareness Month. Just a few housekeeping pieces of information before we get started. About an hour after the webinar ends, you will receive an email with a link to the post-program evaluation. Please complete the survey to provide us with feedback on the program. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Be sure to note on your survey if you would like CADC, nursing credits, both, or neither. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the Partnership's YouTube channel until September 21st, 2022. Right now, we have muted all attendees' microphones, and they will stay muted throughout the presentation, but we would love to hear from you. Please write your questions in the question box, and the speakers will respond to as many as possible at the conclusion of their presentations. Now I'd like to introduce our first speaker, who is Yisel Alaoui. Gizelle is a master's level counselor who has worked in the field of addictions for over 20 years. For the past 14 years, she has been a perinatal addictions prevention specialist. Currently, Gizelle serves as the Partnership of Maternal and Child Health of Northern New Jersey's Community Education Coordinator for our Perinatal Addictions Prevention Project. Welcome, Gizelle.
Thank you, Amy, and welcome everyone. Frank, welcome. And I'm so happy you guys can join us in this afternoon. So let me see if I could move my screen so I could show my PowerPoint. Let's see. Okay, give me 1 second. Ooh, how do I show my PowerPoint? I know it's right behind it. Let me see.
Gizelle? Your PowerPoint
yes.
is showing, Gizelle.
I'm sorry, say that again?
We can see your PowerPoint.
Use the arrow keys on your keyboard if you need to.
Okay, you guys can see it, but I cannot see it. All right, okay, I'm gonna just take it off. Okay, so our presentation is called FASD Through the Lifespan, Providing the Best Care and Support. Disclosures, displanners, and speakers, we have no conflict of interest to report for this activity. What are our objectives today? I'm going to be defining for those of you that was not here on our previous webinar, what is fetal alcohol syndrome? So this might be part 2 for some of you, or this might be, part 1. So I'm going to make sure I cover what is fetal alcohol syndrome, what does the spectrum disorder looks like. We're also going to have a discussion of a personal experience of Fran that is born with FAS, and she's going to identify the impact and challenges that she faced through her lifespan. We're going to describe the experience of diagnosis as an adult and what she encountered, and also understand that at this time it's important for us to know that there's available resources in our community for both children and adults. So let's begin. What are the outcomes of this program? Our goal is for participants to be able to self-report knowledge gained related to the effects of maternal and alcohol use on the developing fetus, identification and support for individuals with FASD, as well as to the intent to change practice, including information and tools presented in this professional webinar. Success on completion. In order to receive both nursing and CADC recertification, contact hours for this educational program, all registered must register and attend the entire webinar and complete and submit a program evaluation. All certificates of attendance will be distributed via email within 1 week of the webinar. This webinar will also be available on the Partnership YouTube channel until September 21 or 22nd. So there are 4 acceptable diagnostic models for screening fetal alcohol syndrome. So we have the Institute of Medicine, the Seattle 4-digit code, the CDC, the Canadian guidelines. In today's presentation, I will focus on the CDC criteria for fetal alcohol syndrome. So because of the development of the child's face, diagnostic features for fetal alcohol syndrome are most prominent from a child from 8 months on to pre-adolescent. Due to differential diagnosis, which includes many genetics conditions listed in this slide, it is best to refer a child to a pediatric dysmorphologist or genetics for confirmation of FAS. Just remember, fetal alcohol syndrome is a pure result of being exposed to alcohol in the womb. So what is fetal alcohol syndrome? So we know this is a disorder resulting from exposure to alcohol during pregnancy, which causes abnormalities and deficits in an individual, covering 3 areas: growth, neurobehavioral, and facial characteristics. In here, I want to make sure that people understand that FAS is not genetic, and it's also not in that you can catch, or maybe you grow out of it. Unfortunately, this is a lifelong disability. When we look at FAS, and obviously we are going to notice that there are some facial abnormalities as a result of this. So alcohol confirmation from mom obviously is really not needed when we have these features in our face, right? It's like when we know the face is affected, we know the brain has affected. However, if mom discloses, obviously the diagnosis will be more strengthened. But we're going to go ahead and talk about that. And just for you guys, if you don't know about this picture that I actually put in this PowerPoint, this is a picture of a woman from Ireland who used to drink a quart of vodka. And as you can see, her child has full-blown fetal alcohol syndrome. Now she's in recovery, taking care of her. And you could find her story in the National Geographic if you Google it. So the CDC criteria for fetal alcohol syndrome. We know babies are born smaller for the gestational time and usually remain small throughout it. You know, these children, they don't grow up to be basketball players. The most, devastation that we see with fetal alcohol syndrome, as well as with the spectrum disorder, is the impact on the central nervous system. We have, we can see, problems stemming from cognition, motor, social skills, attention, hyperactivity, executive functioning, central nervous system abnormalities across the spectrum of FASD. The facial abnormalities, again, they grow out to have distinctive facial features and is widely spaced eyes. And again, this is all being measured by physicians, by genetics. A short upturned nose, a smooth philtrum, and a normally thin upper lip. And you see here in the picture, you have Kaylin that has fetal alcohol effects and Johns that has the full-blown fetal alcohol syndrome. So when we're looking at the facial dysmorphology, again, we're looking at the short peripheral features, which is just small eye opening, the small philtrum, which is the thin vermilion border lip, right? We are also looking that many of these children with FAS may also have been born with many other medical problems, including heart and kidney defects, as well as bone, joint, eye and ear, and liver dysfunction. Additionally, they are more susceptible to illnesses such as colon ear infection. And this is important to notice. Again, you see other you see other arrows, naming other parts of the face, because one of the things that we know is that there are other other features that alcohol can also impact. So some individuals might have epicanthofold, which is an extra layer of skin. Some individuals can be affected in the ear side, right? And there's actually this formation of the ear, and obviously we have deformation of the ear, we're going to have hearing problems. Again, alcohol does whatever it wants to an individual. It can touch every organ. So it all depends, again, in the genetics of mom and the genetics of the child, the time of exposure and the amount of use and the chronicity of the alcohol being used. Again, some children may have underdeveloped jaw, but the CDC criteria, we're looking at 3. Again, it's the facial, the growth, and the central nervous system abnormalities. Those are the 3 where we have our full-blown fetal alcohol syndrome. Again, this is only the tip of the iceberg. And what I mean by that is if I show you right here, we might have in the tip a lot of children that probably passed away because maybe their brain was not formed correctly, right? So this is the syndrome is what we can see, right? We see the brain impacted. But the big numbers that we have, that we experience in the United States is not the facial features. It's actually the one that we cannot see, which is, it still is the developing brain. This is when sometimes we hear mothers being told that it's safe to drink during the third trimester, to drink wine instead of beer, or receiving misinformation. Again, so in here we can have different aspects of the child being affected. So we can have, for example, partial fetal alcohol syndrome, fetal alcohol effects, alcohol-related neurodevelopmental disorders, alcohol-related birth defects, right? And in here, we do need mom's confirmation to say, I drank alcohol during pregnancy. So this is a big problem that we have, because not many times mom doesn't even know that, she missed her first period. And, we learned that she is pregnant into, we first learn about it until she's 4 to 6 weeks into the pregnancy. And women sometimes might have continued to be drinking and not realizing that they're pregnant, right? So fetal alcohol spectrum, this is an umbrella term. This in here we need obviously alcohol, the umbrella or the fetal alcohol spectrum disorder. This is not a diagnosis. This is just a general term that we use. Here we want to show how alcohol adversely affects the prenatally the central nervous development. So this is what we want to show here. And in here again, we need mom's confirmation of alcohol. In New Jersey, we have 6 diagnostic treatment centers where we can get, we can take our children to get diagnosed, right? Is from birth to the age of 21. We used to be able to do until the age of 40, but unfortunately, due to cuts in funding, we are unable to do this, but we can still do it from birth to 21 years old. And what is important here is that to take a look is that obviously you need, the professionals need to make a comprehensive assessment and management of the individuals with fetal alcohol syndrome and the spectrum. Again, to get an accurate assessment and diagnosis, this may include an input from a variety of specialties and should include a comprehensive assessment of an individual's mental health, developmental, and behaviors domains. Now I'm going to go back here because I would like to be able to introduce, and let me just take my arrow away. Here we go. Okay, and I want to introduce Frances McLean. Frances McLean has been chosen to speak for the National Organization of Fetal Alcohol Syndrome. She has been interviewed for a newspaper article titled "Get to Know Me: My Life with FASD" in August of 2012. Her most recent recorded video for the National Organization of Fetal Alcohol Syndrome was on March of 2014, and this was titled "Fran Living with FASD." Her video had more than 6,000 views. Fran has been a friend to me and to the partnership for years. She has collaborated with me to bring prevention education on FASD to the men and women in rehabilitation centers in New Jersey. Fran is well received by the men and women at these facilities, and she always brings a message of hope and recovery. Besides her wonderful quality of giving back, Fran is also a very patient person and loves to listen to others. Without further ado, let me introduce you Frances McLean.
Hello. Thank you. Thank you to the Partnership of Maternal and Child Health for having me today. And thank you, Gizelle, for calling me and asking me to share my story today. At first, when I was asked to share my story, I was nervous. And I'm nervous now, but I will be fine. But I asked myself, can I make a difference? And then I realized that, yes, I can make a difference today. I am open and I'm willing to share my story. So thank you again. And I'd like to start with, I was born with fetal alcohol syndrome because my mom drank during her pregnancy. I was born in 1960. I was 4 weeks early. My birth weight was 3 pounds, 11 ounces, and I was 16 inches long. I was cute when I was born. And because I was so small, I was in an incubator. And at that time, the doctors told my family that I was not going to make it. So therefore, the next day, I was baptized in danger of death. But this is the part I always like to share, and that is God had other plans for me. I was a fighter, and I came home a few weeks later. So I'll share a little bit about my mom, and that was my mom was an alcoholic, and she was a very angry woman with a lot of rage. I didn't know it at the time, but she suffered from depression. And back then in 1960, they didn't have help. She never got the help that she needed. The drinking and smoking was her way of escaping all that pain. And she also grew up in an alcoholic family herself. So drinking was all that she knew. So I was told that she did enjoy singing. She was a professional Irish step dancer. And she played the violin when she was younger. That's in the 60s. Drinking was not seen as being a health hazard. It is today. So my family told me I was a happy baby. I had a lot of energy. And my family had their hands full with me. And I was told that when I was younger, I lost my balance and I fell down a flight of steps. That I had broken my leg 3 times by the age of 6. What I don't understand is why they never investigated why I was falling, why I was losing my balance, and had these accidents so young. But one thing I do know is I'm glad I don't remember. That when I was born, my sister was 7 years old, my brothers 8 and 9. I was the youngest. And I always like to share that the 7 years before I was born, my mom's drinking progressively got worse. So when she had me, it was bad. As you can see, you know, how early I was born, how little I weighed. But at that time, my dad had worked 2 jobs and he kept food on the table. He was a New York City bus driver during the day, and at night he worked at a bar as a bartender. You know, I remember we lived in a small apartment in Washington Heights in New York City. I remember my grandmother and my uncle lived in the same building, but they too were alcoholics. So I'll share now what it's like to grow up in grammar school. When I started school, I remember I was shy. I never felt I could trust. I had a hard time focusing. I always felt different in a way that I could not understand. I know it was hard for me to socialize with kids. I remember one summer, the school told my mom that I should repeat a grade, that I was not ready to step up. But my mom was not going to hear it. She had such anger that people just walked away. But I wish that they did not let her anger stop them from trying to help me. I needed their help. So I wasn't left back. I continued to struggle with spelling and math. I had speech therapy until the age of 7. Spelling was very frustrating for me because I could not understand the vowels. Again, no one back then thought to look into to see if I had a hearing loss. Reading was also a challenge as well. It was hard. It was very hard for me to go to school. I did not like it. I just wish that the teachers back then had paid more attention. I always felt nervous as a child. You know, coming home from school, I was always anxious because I never knew what I was coming home to. I knew my mom was drinking, and I would never bring friends home. I did not want them to see that my mom was sick. And I was also very ashamed to have a mother who drank. Yeah, I was home a lot. I was home alone a lot. I was about 7, 8 years old. I would come home from school for lunch, and I would watch my favorite show, Bewitched, and I would make myself SpaghettiOs. I was able to do that on my own, so I did. And growing up in my house, an alcoholic family, there was a lot of drama. My parents were always fighting. There were always many arguments in my family. And at that time, my older brother was drinking, and he was in trouble with the police a lot. And the police were at my house a lot. My brothers would get into fights among themselves. My sister would argue with my father. And all I knew is that when my mother was drinking and in a rage, I was terrified. I was terrified of her. I just wanted to run. And I will share that one day, I was playing outside, and my mom and I had this big fight. And I had a lot of anger towards her because I just wanted to be a kid. I was outside playing, and, I knew she wasn't feeling well, but I had a bad feeling. Something was not right. And then that week, my mom died. I was 11 years old. And I remember thinking that her dying was my fault because we had this fight. And I was too afraid to talk about it. I had no one to talk about it, really. And I remember that day, a part of me just shut down. And I kept asking myself, who's going to take care of me? What are my friends going to think? My mom was 42 years old. And my family told me that she had died from emphysema because she was smoking as well. But the sad thing is that they never talked to me about the drinking. Now, my father was having a hard time. He continued working the 2 jobs, and he was drinking a lot. I didn't see him much, and we never talked about my mom. None of them. No one talked about my mom. This is part of the family secret. You know, you never talk about what happens at home. There's too much shame, hurt, blame, anger, guilt. No one talked about it. And there was no answers to a lot of questions that I had as a child. My sister was 17 years old at that time, and she had to raise me. You know, she graduated high school and she gave up everything to take care of me. She did not have a chance to do what she wanted. She was raising me at the age of 17. I was very blessed that she was there for me. She was taking care of my dad as well. She was doing the cooking, she was doing the cleaning. And the sad part is she had no one there to help her, help me. Yeah, at the time, my dad was working. One of my brothers was going to college to become a pharmacist and working at a pharmacy at the time. My other brother was an alcoholic and he was living in his car at the time. In February, I was at a friend's house. We were playing tag. I was being a kid, having fun. My friend's little sister decided to take her socks off and leave them on the floor. I did not see the socks. I went flying up in the air. And part of me knew if I landed on the back, it was going to be bad. So part of me, I pulled out, I put out my elbows to stop the fall. And when I did fall, I dislocated both elbows. I knew they were broken. I knew they were broken. And I told my sister and my brother that they were broken, but at the time, because they were dislocated, I was able to move them for some reason. And my sister and my brother told me, I'll be all right. I just hit my funny bone. And that I was not to say anything to my dad because they would be in trouble. They were at the bar across the street celebrating a friend's birthday. My father put them in charge of watching me while he went away to visit a friend. So I knew if I said something to my dad, they were going to get into trouble. So I didn't say anything. They gave me Advil and they put me to bed and they went back to the bar. When I think about it now, I still feel the pain, but I went to school. I didn't say anything to anyone. I remember going to school, I wore long sleeves to hide the swelling. But I do remember this. When I went to school, I kept thinking, I wish someone would notice me. I was in so much physical pain. But I was also too afraid to say anything because I didn't want to get my family in trouble. I just couldn't understand why no one would listen to me. I knew I was right. Yeah. But a week later, I was not able to move my arms. Of course, they started to heal. So my family had to take me to the ER. And I was told I wasn't going home. I was going to be in a hospital to have surgery. By now, I felt afraid and my fear was growing. I was thinking I was nothing but trouble. I was always having accidents. I kept asking for my dad. I didn't understand why he couldn't come to see me, but my family said he had a hard time coming to the hospital because my mom had recently died. But I was thinking as a child that he didn't love me. I kept thinking maybe he knew about the fight I had with my mom and he was angry, or because I didn't tell him about what happened a week ago. He was angry. I was a mess. All I know is I thought all of this, or most of this, had something to do with me. It was my fault. Anyway, I was in the hospital for a week to let the swelling go down. And then the first surgery, they had to reset the bone with pins. Then another surgery to remove the pins. I don't know how long all this took, except I knew it was long. And I remember feeling lonely. I wanted my dad. I missed my friends. But eventually I recovered. And I finally went to school and I graduated grammar school. I did not do well on the exams to get into high school. I knew I did bad. And of course I didn't get into high school. But my dad had a friend in the family and they helped me get into a high school. I did not understand why my friends were going to high schools close to home and with friends when I went to a high school in the Bronx and I had no friends. Part of me knew, but I also didn't have the courage to ask. High school was stressful as well. I continued to struggle with math. Holding numbers in my memory was hard. I continued to struggle with English, reading, and comprehension. I hated when people asked me what that was about, what that story was about, because I didn't understand. I did enjoy playing basketball. I was good at it. But soon I learned that because I broke my elbows, I had trouble. I was looking so forward to going to high school, being on the basketball team, but as I tried playing, because they didn't heal properly, I realized that I was not going to be able to play basketball. So I was disappointed because I wanted to be on my basketball team. So I continued not to be good at socializing with friends and gatherings. And at this time, I was starting to feel like I didn't know where I belonged. My anxiety started to grow more, and it took everything I had to stay focused on schoolwork. I remember telling myself I was not going to fail. I was not going to disappoint my family. I was going to get through high school. I was not aware at the time, though. I was to plan my future for a career. I had wished someone sat down with me at that time and told me why it was so hard for me, why I had such a hard time. I had no one to turn to, but I do know that the reality of going out into that world terrified me. I survived school and I graduated, but I had no idea what I was going to do next. You know, my sister had wanted me to go to college, and of course I did not want to disappoint her, so I applied. Part of me knew I would not be able to do it, but I did. I applied. I started to get depressed around this time and anxious a lot. Again, I was not able to comprehend a lot of the readings I had to do. I could not keep up with all the classes. I was starting to feel very overwhelmed. I was gaining weight. I was having a hard time. I remember I repeated math classes a couple times, at least twice, and I failed. And then one day, I took an art class, and we had to present a piece of art that was edible. And I remember thinking I did not know what edible meant. And I was too embarrassed to ask. So the following week, I just showed up at class. And then when I realized what edible meant, I was devastated. I was embarrassed. At this age, I should have known what that meant, but I didn't. So I remember thinking to myself, I don't belong here. I didn't know where I belonged, but I remember I got up and I left. I just left, never went back. I didn't say anything to my sister. So every morning I just got up, got dressed, acted like I was going to school. And I got on the bus and I would ride the bus downtown and back up until she left. And I never thought to think that the school would call her, but they did. I got caught and she let me have it. Through yelling and screaming at me, telling me, you know, stop being lazy, go get it life for yourself. And I remember thinking, but she never thought to ask if I needed help. You know, I felt like I had to be someone else. I had to pretend. I had to pretend to be someone I wasn't in order to survive. So I knew something was wrong. I knew something was not right. And now I know that I had a learning disability. And I think to myself, if someone had just helped me, and if I had known I had a learning disability back then, how much more I could have done, other choices I could have made. But I went out and looked for a job. I continued. I was not able to hold on to a job. My anxiety was so high that I could not focus on what it was I was supposed to learn. You know, the world was starting to get too big and scary. I was beginning to feel lost, and my family was still in denial. I knew I needed help, and here I was, out of high school. I'm supposed to work and make a living for myself. You know, a friend of the family helped me get a job as file clerk, and I was able to learn that. I did good. The company encouraged me to learn how to type, and I did. I did well with that. And then the company encouraged me to take a desk job and work for a representative. I realized that I couldn't spell a lot of words. And I also realized that the more responsibility I took on at this job, the more difficulty I was having. And I realized to myself that I couldn't do this job. And I made a lot of mistakes. I was devastated. I was embarrassed. You know, I panicked and I quit. And then my brother helped me get a job at the hospital, taking calls for an office. This too was too stressful, too fast for me. But I was too afraid to quit because I did not want to disappoint my brother. I remember one day that I was at the office and I saw this memo. It was for employees, if they needed help, to contact a social worker. So At the time, the office manager was very mean to me, very nasty, very hard. So I decided to go see the social worker, and, you know, I wanted to tell her how not nice this person was with me and how badly I wanted to quit, but I was afraid to. So I started to see her for a while. And then one day she asked me if I had alcoholism in my family. And I said I did not know. Oops, hold on. And then she was nice enough to explain to me the roles of the children of alcoholics. She was telling me about the lost child, the controller, and so on. And she gave me information about this. And I was able to see myself as the lost child. And I realized that alcoholism was in my family. I was in shock. I knew my family drank, but I didn't know about the family disease. There was so much I did not know. But I wasn't ready to hear anymore. I felt devastated. I quit my job. I moved to New Jersey. I moved in with my brother. And once again, you know, I had to go out and find a job. Part of me also was in denial. I believed that at that time that was the only way I can survive. So I was able to get a job as a cashier, but I couldn't make enough money to support myself, and I didn't know how to budget my money. I just had a hard time. And I remember that I never had enough money to pay the rent. I was getting angry and frustrated myself. You know? All I wanted to do was be able to work a job and be able to support myself. Around this time, I was very into jogging. I really loved it. It was a way for me to work through my anger instead of hitting the walls or hitting the desk. That's all I knew. I mean, I was angry. The only way I knew how to express my anger was to hit something. So I loved running, so I did a lot of jogging, and for me, it helped. You know, so I was doing a lot of jogging, but I was also having a lot of foot pain, and I decided to have surgery for the bunions. At this point, I was ready to do anything to keep running, but I found out that I had loose joints. I had to have another surgery to fuse the bone. And I did this, and I continued to be able to jog for a long time. But what's important about this is that the medical bills were adding up. And I still was not able to live independently on my own. So I had gotten a new job as a cashier for CBS a few years later. I remember being at this job for about 3 months. And my medical insurance had just started. And it was a winter day, and I was on my way to work, and it was snowing. I stepped in a puddle, and I slipped on ice. I fell down and broke my ankle. I kept thinking I was blessed that I had insurance, but I was out for another 8 weeks. But this, for me, was just the beginning. This is what it was like throughout my life. I continued to struggle to make money to support myself and pay rent and medical bills. I started to get depressed now. You know, I was renting rooms at the people's houses. because I could not afford a place of my own. But one day I was working and I saw a business card from a therapist who worked with families and alcoholics. I was 25 years old at this time. I was feeling very depressed. I was feeling desperate. I'd wanted to end my life. I was tired of fighting. All I wanted to do was be able to live a healthy life, have a place of my own, and be able to live independently. But at this time, I still didn't recognize what was going on. So anyway, I saw this card, this business card, this therapist, and I was desperate. I just remember thinking to myself, I wasn't going to give up. So I called this number on the business card and to make the appointment, but I was so scared I kept hanging up. I must have did this like 5 times. But something kept telling me not to give up. You know, I had a choice to make and I decided to get help. I did not want to go down the path I saw my family go down. So I made the appointment, and that was the day that my life started to change for the good. Making that phone call was my first step in my recovery for a better life. It was a long, hard road. It was a very long, hard road. But the therapist helped me to take it one step at a time. Her name was Jane. She was very kind, patient with me. And over time, I was able to trust her. But she also encouraged me to go to Al-Anon meetings. She helped me to learn about alcoholism as a family disease and how it affected me. She reminded me that I had choices. She helped me to learn and recognize my limitations. Helped me to recognize my feelings and helped me to learn how to work through my anger in a healthy way. Encouraged me to get medication for my depression and anxiety. And most important, she helped me to see and understand that I had fetal alcohol syndrome. And over time, we decided together that I had to find a way to get diagnosed for fetal alcohol, because I just knew I needed to get diagnosed. And she also helped me with to accept that I had eating disorder and to find support groups as well for that. As I was going to therapy, I came to understand that no one was going to take care of me, and I knew I was never going to be able to get a job where I could make enough money, support myself, and to be able to live independently. Because I'd never been diagnosed with fetal alcohol, I had to find proof in order to receive services and support. So I started making phone calls. It took me about a year. I had found the only proof that I had was my history. And I had found 2 photos that you will see on the PowerPoint. That was my only proof And in these pictures, you can see the facial markings of the fetal alcohol. It took me about a year and many, many phone calls to find someone to help me, give me direction. And then one day I was able to reach an Ann W. from the ARC program here in New Jersey. She was the director of the prevention program, and she helped me get in touch with a doctor at a diagnostic center here in New Jersey, Newark, New Jersey. And the center was for children of fetal alcohol. So I had to explain to her how important it was for me to be diagnosed. I was 43 years old at this time, and I was still not able to live on my own. I was back living with my sister, and she was selling the house, and I was told that I could not live with them. I was desperate. So I was blessed also because the doctors and the team were able to come up with a creative way to see me as an adult at this center. I was able to be seen and evaluated for fetal alcohol. Between the pictures I had and the history I had and the medical records I kept, I was able to be medically diagnosed in 2002 at the age of 43. And this was also when I decided to be an advocate for children and adults for fetal alcohol. Because I believe there's no reason anyone should have to go through what I did. No one should have to wait until 43 years old to be diagnosed. I should have had help many, many years ago. But I'm here now today to tell you there is hope. After I got diagnosed, I was able to start the paperwork for the Division of Developmental Disability for Services. I started this process in 2003. It was a long, hard road, many setbacks. Many times I fell through the loops, but I kept at it. I was not going to give up. I received the services in 2011. 8 years of hard work. It was worth it though. I was able to get a caseworker. They helped me to apply for housing and assistance. I applied for food stamps. But this also took time. Housing, I applied for it, but it took many years for me to get the housing. It wasn't until 2015 that I was able to get into an apartment under, I would say, emergency situation, where I was living. There was a aide who was helping them. I was living with a companion, and she had an aide. This aide was starting to push me around, and knowing that I had, at this time, I knew I had brittle bone. I think I'm gonna say in my 30s. I did skip this part, but in my 30s, I was having a lot of back pain. And in my 30s, I was diagnosed with osteoporosis.
Excuse
But
me,
the
Fran.
yeah.
Oh, so sorry, Fran. I didn't
That's
want to
it.
interrupt you. I'm just, I want to thank you so much for sharing your story. But I wanted to make sure I look into to see if we have any questions because we have a few minutes left.
Sure.
So I am so grateful and thank you so much for sharing your story. I know you have a few minutes left to share, but I just want to let you know I'm want to be while you finish your story. I'm just going to check in to see if there's any questions. So get ready if there's any.
Sure.
Thank you. So go ahead. I'm just going to check in.
Okay, thank you. So what I like to say though is that there is hope. I'm now living independently. I'm living in a beautiful apartment that is handicapped accessible, and I'll quickly say that in my 30s, I found out that I had brittle bone, and I also found out that I had hearing loss, but I was able to find a support group for the brittle bone, and they helped me find services and help found ways to be able to live, stand up for myself. It was hard to get an apartment that was handicapped accessible, but I had to fight. I knew I had a learning disability, brittle bone, and I was not going to let anyone stop me. So I am here today to say that things can happen, good things can happen. There's help out there. There's services out there, services like the Partnership Maternal and Child. There's resources, Al-Anon groups, meetings, and all that information you can get through the Partnership for Maternal. That's
Thank you, Fran.
You're welcome.
Thank you, Fran. It's interesting because that's exactly what they're asking. They're asking what specific services are available in New Jersey for families affected with FASD. I want to let everybody know that we have a guidebook, FASD guidebook. This was developed by the New Jersey Task Force on Fetal Alcohol Syndrome. And as you can see, it's behind, obviously, our pictures. It's kind of hard to see it, but we have not only the guidebook, but there's also a website. It's called fsdnj.org, when you can find services that are available for both children and adults in the state of New Jersey. So please, I encourage, if you are a provider, if you are a parent, to look at the FSD guidebook that has been created, this manual to help you navigate through the system. So let's see another question. It says, Fran, you mentioned you had family secrets. Why is that? Why do you think there's family secrets at home?
I say it's family secret because if there were not family secrets, I believe that I would have been able to get the help. I fell through the cracks of the system so many times. There's so many times that I hear my family not talk about what happened. It's a matter of the family is so much into the shame, the guilt, the anger. It was very, very hard for me to get my family to talk about my mother's drinking in order for me to get where I am today. And it took years, but the shame and the guilt, it's hard. You know, people don't want to talk about it.
Yeah, absolutely, Fran. We're still dealing with stigma today. We're still dealing with, we don't want to talk about addiction or mental health or whatever other circumstance might be. By the way, a lot of our participants are saying, thank you so much for sharing your amazing story, Fran. People really have been touched by your story. Let's see. They're asking, does the partnership offers counseling service to pediatric patients and adolescents? And so I guess that question is for me. With the partnership, we don't offer direct services. However, we can guide and try to navigate, help you connect with services that are available, because we do know we have a directory of services for women who actually might be experiencing substance abuse issues. And through there, we have other resources, but we'd be happy to assist. But we don't actually have direct counseling. We have for pregnant moms, we assist them if you are a first-time mom. They assist them and provide them with lots of, care throughout her pregnancy, but not directly counseling services. I see Amy on board.
Yes, I'm here. Sorry, because this is just, hi, Fran. This has been such an amazing webinar. I want to thank Fran for sharing a very moving story. It was wonderful that you could take us into your experiences, and I think I speak from all of the attendees to say it was really, really appreciated. And I want to thank Gizelle for, of course, the introduction and then this short question and answer period, which we do need to cut short so that we can be respectful of our attendees' time as well. Just a reminder to the attendees that you'll receive an email with a link to a post-program evaluation. Your feedback is important, so please take the time to complete it. You should receive your certificate in an email within a week. And again, make sure that you let us know what kind of credit you want. I also want to thank Laura Hall, who has been running the back end of this program, and to let you know that next month, the partnership will be acknowledging Domestic Violence Awareness Month with a 4-part webinar series. We will also be providing a webinar on perinatal grief and support as part of our perinatal and infant loss activities. To learn more about these programs, please visit our website at www.partnershipmch.org under the Professional Education tab. We also offer on-demand recordings of many of our programs, which are listed there as well. Hope you can join us at our next program. Thank you.
Thank you, everybody. Thank you for your time, and thank you, Fran, again,
You're
for
welcome.
everything that you do. Thank you.
Thank you. Thank you for having me.